If you're like us, you've probably been a little confused by the conflicting messaging from the media and government on public mask wearing. For instance, on February 29th, the US Surgeon General tweeted in all caps, "Stop buying masks, they are not effective." 1 month later, on April 3rd, the CDC officially recommended that Americans wear homemade cloth masks in public. Why did the CDC change policy so abruptly? What evidence exists that wearing homemade cloth masks is effective?
So first, it's important to note that the CDC tends to rely on very high quality evidence. And the truth is, there's been limited trial evidence that when the public wears masks, infection rates go down. Part of that is that we've never had a pandemic of this kind in the West in generations, so the research literature is limited. But it's also hard to design a trial for public mask wearing. After all, how do you control for the way that people wear masks, or for how long, or even what material the mask is made of, or a dozen other possible factors?
It's precisely for these types of reasons that the CDC initially didn't recommend it. There was a worry that people would wear the mask improperly and touch their face even more because of how uncomfortable it can be.
They were concerned that people would panic and buy up all of the medical masks, especially when global supply of medical protection has been critically limited.
And there is also this idea of what experts call risk compensation, that people are more likely to engage in risky behaviors when they think that they have more protection. Sick people might think it is okay to be in public as long as they have a mask, and the general public may observe less distancing if they believe they're protected by the mask.
But on the other hand, we do have a lot of theoretical evidence that cloth masks could help, with studies showing that a significant percentage of particles do get filtered by masks.
And cloth masks can be made at home without endangering the supply that doctors and nurses need for their constant close quarters exposure.
And maybe most importantly, if everyone wears a cloth mask, we might have a shot at slowing the asymptomatic spread that seems to be driving the pandemic. Experts are increasingly worried that most people spreading the virus aren't visibly sick, but that they're actively shedding the virus in their breath. Masks could go a long way in limiting that.
So we've established that the research hasn't yet proven that masks lower the actual rate of infection, but the evidence is promising that masks do reduce particle spread. Impressively, in lab studies, cloth masks were capable of filtering up to 86% of particles the size of 0.02 microns, which is almost as high as the filtration of a standard surgical mask. It's important to note this differs widely on material of the mask, how damp the cloth gets, and how loosely fitted it is. If your breath is escaping through the sides, the mask will be much less effective.
Now, we don't know how effective a mask really is at protecting the wearer from others. Tiny particles float through the air and can go right around your mask. Again, we have some preliminary theoretical research that shows that wearing a mask can potentially reduce how many particles get to you, possibly up to 10-fold, but we can't definitively put a number on how much wearing a cloth mask can protect the wearer from getting sick.
So you might be asking, if the loose fit of a mask is an issue, why not tell everyone to wear N95 masks like healthcare providers do? Problem solved. Well, there's a variety of reasons. 1. The N95 is only superior because it provides a potential full mouth and nose seal to ensure the tiniest particles can't get in. You have to be specially fitted for one, you cannot have any facial hair of any kind, and you cannot by any means remove the mask, loosen the straps, or in any other way loosen the seal.
We've both worn N95s, and I can tell you that even when we're in the hospital, it's easy to lose the seal. The mask itself can be pretty suffocating, and it's pretty uncomfortable to wear. People often fidget with the straps and the seal a lot because of how it irritates the face.
And the biggest reason is that doctors desperately need them. Unlike us, they see dozens of sick, coughing, sneezing patients up close, day in and day out. And even at this stage, the United States has a significant shortage, causing doctors to wear the same mask all day and in some cases all week. We have to save them for the people on the front lines of this pandemic.
So how do you wear a cloth mask effectively? Now, when you wear a mask, you have to wear it correctly, over the nose and mouth, and securely fastened so that it's actually providing a filtration effect.
Don't touch your face or the outside of your mask. The outside is now off limits. That's where others' particles are hopefully getting trapped. Only adjust your mask when you absolutely have to, and touch only the straps or edges of the mask, and wash your hands immediately after adjusting.
And when you take your mask off, wash it with soap and water between every use and leave it to dry. Washing machines are fine, but don't use bleach since it can denature the fabric and leave larger holes, defeating the purpose.
So let's say you're sold and you want to make your own mask. The material does matter. The important thing to remember is that the tighter the weave, the better the protection. We've listed some here that have performed well in lab tests, but are still breathable. The New York Times article referenced below has the full scoop.
If you go to the CDC website, they offer different methods of making your own masks, including no-sew methods that can be assembled in a matter of minutes.
And finally, remember, we may not have evidence that masks reduce the infection rate, but we can estimate the number of particles that a mask can trap from circulating in the air around us. If everyone wore them in public, we will likely slow down the asymptomatic spread of people who don't even realize they have it. It's all about keeping everyone's breath to themselves.
At the end of the day, mask wearing is a wise addition to the other common sense strategies we're already following, staying inside and away from others as much as possible, keeping a 6 foot or more distance in public, and washing our hands carefully. By doing all of these together, we can work together to slow the spread. Hey, this is Dan.
And Dan.
And we're both medical students in New York City who have a passion for healthcare education.
All of our videos are carefully researched and cited.
If you found this video helpful, please like it, reshare, and follow us for more content.
And if you have questions about healthcare topics and would like easy to understand research-backed answers, contact us via our social media.
Thanks for
watching.